Welcome back to our video series, Employers Are Asking, where we answer your questions in real time. My name is Sarah Michaels. I'm a registered nurse, and I'm the director of Kinetiq Health here at Apex Benefits. In this week, we had some exciting news, whereas last week, 16 and older are now eligible for the vaccine. And so, of course, fresh in my inbox this morning was the question, what can I safely do after being fully vaccinated? Well, we know those numbers of fully vaccinated individuals will actually continue to rise now that we've opened the floodgates, as I say. So let's address that question. And to address that question, we should probably answer, what does it even mean to be fully vaccinated? So by the CDC definition, it means that you actually have to wait 2 weeks after getting your second dose of the Pfizer or Moderna, or wait 2 weeks after receiving the one-shot dose of Johnson & Johnson. The reason we have to wait the 2-week period is because the body needs to build up those antibodies to fully be able to protect us. So it's really important we wait 2 weeks. And I say that, even though it means fully vaccinated, doesn't necessarily mean fully protected 100%. We know no vaccine can give us 100% effectiveness against any kind of attack. And so we know that the Pfizer and Moderna is pretty high up there. It's right around 95% based off the clinical trials. Now, what people don't know is Johnson & Johnson is actually significantly lower. After 2 weeks, it's only right around 65%. But if you wait almost a month, it's closer to 85%. So again, fully vaccinated, we have to wait that time period to really feel comfortable being with others in those environments. So the other thing I like to tell my patients is that if you think about the flu shot, if I get the flu shot every year, that doesn't mean I'm not going to get the flu. I can still get infected with the flu. But what the flu shot does is it prevents me from hopefully getting seriously ill, resulting in hospitalization from pneumonia, per se. So if we think about the flu shot similarly to how we would think about COVID-19, we know that I could still potentially get sick with this infection, but hopefully I don't end up being hospitalized. And again, we're trying to reduce the death rate, which we have seen through this vaccination process. So if you think of it that way, let's talk about what it means to be low risk when I'm vaccinated. And to think about low risk for those vaccinated, what we actually have to do is think about those people that are not vaccinated. What are the characteristics of those around me? So if I'm not vaccinated, I want to be sure that if I'm going to be with that individual, can they safely be with me with my mask off? What CDC now says is fully vaccinated people can be with other fully vaccinated people without practicing social distancing and without wearing the mask. However, I can also be with people that are unvaccinated as long as they're low risk for potentially getting COVID, meaning you don't want to be with people that fall in the high age category if they still haven't been vaccinated and they have high health risk, okay? Let's make sure we're there. The other thing that's kind of cool is if I'm vaccinated, I actually do not have to get tested or even do a quarantine period if I'm asymptomatic, meaning I do not have any symptoms such as a flu, a cold, a cough, loss of smell, which is a red flag for many individuals. So the only time you want to make sure you are tested are if you do have those symptoms, even if you've been vaccinated. Still get tested, see what the test results say, follow quarantine only if it comes back as a positive swab. So with that, I know that there's a lot of questions that are coming in your heads. Make sure you let us know if you have any burning questions about COVID, about benefits, anything in general we can ask and we can answer during Employers Are Asking. We'll see you here next week.